All right, so we're in the front area. Pretty easy stuff. I do not deviate from my front area speech or spiel, you could call it. Patient is usually sitting on the couch or the chair, and I would just walk up to them, and sometimes I'll kind of act confused. And I know that might sound weird, but the reason I act a little confused is because I want to make sure I get their name right. And so I might look at their name, and if it's a tough one, that's when I act confused. If it's an easy one, I'll usually confidently walk up to the patient or call out into the waiting room like, Maria, estamos listos, right? Maria, we're ready. Or Maria, estoy listo. You could say estoy listo or estamos listos. Just pick one. They both mean the same thing. Estamos means like we're ready. Estoy means I'm ready. So you could say, Maria, estamos listos. Doctor Castillo, mucho gusto. Right? And that's if you know where the patient is. Let's say it's like Eustoquio. That's a tough one. There's a guy that came in, it's like Eustaqu. I mean, it's just all over the place. And I'm not a native Spanish speaker, so I'm looking at the staff like, what is it? They know. So I go, Eustoquio es correcto, no? Right? And then they'll say, sí, doctor. And I might ask them like, la pronunciación está bien, right? Is the pronunciation good? And if it's good, great. If not, they'll correct me. And then I'll actually have to either write the name down and study it later or just practice with the staff afterwards to make sure that we get the name correct, because names are super important. And I guarantee you somebody else is effing up their name in some other medical clinic, but not in ours. Now, names will be said perfectly. So Eustoquio, or there's got to be they're just other, like Virginia, right? You have to say an H instead of a G for Virginia. So just making sure you got the name down, perfect. Pase adelante conmigo. It means pass forward with me, please. Pase adelante, por favor. And then I'll just gesture with my hand. They'll come with me. Sometimes I mention here, tenemos las terapias, los cuartos del ajuste. Or sometimes I'll just say nothing. And I'll say, let's say it's Maria. Maria, por favor, sentada aquí, por favor. And then I'll shut the door. And then I'm sitting at my desk and I got my paper and we're ready to rock and roll. So that's it. Waiting room to the office, I'm literally just saying like their name. So Maria. Or if I'm confused, meaning the name, I might not be able to pronounce the name right. Eustoquio, right? Or say whatever you feel like it is, but say it in a confused way so that if they do perk up, be like, eso es correcto, no? Right? It's correct, or la pronunciación es diferente. And then they'll like comment, you're like, oh, it's actually said like this. And they're like, okay, disculpe, mil disculpe, right? They guys, like, you gotta walk it through from their perspective. I guarantee they probably have never met another doctor in their life that has spoken Spanish to them. So if you're just trying, they're so thankful. In fact, some patients have said like, wow, it's so cool what you do. That's so cool that you're learning Spanish. Like, they're literally cheerleading me to this day. Like, and I'm 9 years into the profession. So like, they'll be super excited for you even if you mess up. And that's it. So we'll move on to the day one right after this video.